Now we'll move from underground to the biomechanics, where we have Dr. Jennifer, who from the sports medicine, she's working on developing new strategies to treat chronic heel pain. So welcome, Dr.
All right. Hi, my name is Jen Xu, and today I'm going to be talking to you about how movement can be medicine. Okay, so we're going to talk about the next steps in treating heel pain. And so just to be clear, my research was funded by several different mechanisms, so I wanted to put them up there to disclose. And then Zero Shoes did provide the footwear for this study. So heel pain, you might also know it as plantar fasciitis. You might even know someone who has it, right? Pretty common. The plantar fascia is a tissue on the bottom of the foot, okay, and it supports the foot. And so sometimes it can get overloaded, and that can lead to pain in the heel, as well as difficulties with activities of daily living, reduced physical activity, and even poor mental health outcomes. One other thing that it results in is weakened foot muscles, which is really the focus of my research. And if you imagine, right, the foot muscles also support the foot. So when they're weaker, that's not great, okay? And heel pain is a problem, right, because it affects 1 in every 10 people in their lifetime, right? That's a lot of people. There are really high costs. Yearly healthcare costs can be up to $376 million, and that was in 2008, right? So we can only imagine what that's like now. We also know that it affects a lot of different types of people. From runners to sedentary individuals who don't exercise at all, military service members, and even occupational workers like nurses or factory workers. So this is kind of a widespread problem. But the bigger problem is really our treatments, right? We're struggling to find our footing in treatments for heel pain, okay? Patients do try a lot of different treatments. They might try rest or ice, wearing insoles, you can see. Or doing some types of injections, right? But the problem is that all of these have pretty limited evidence for their effectiveness, okay? And what we know is that there's a 44% risk of still having symptoms even 15 years after your foot starts hurting, okay? And so kind of like this person up here in this comic, right? They're just going to ignore their pain for the rest of their lives. And that's what a lot of people with heel pain do, just because there's not a lot of great, info on what treatments are available and things like that. So the big question is, right, how can we defeat our arch nemesis, which is heel pain, okay? Preliminary studies do show that strengthening the calf and foot muscles can help in reducing pain and improving function for people with heel pain. One way you can do that is by performing strengthening exercises, of course. The one picture at the top is showing how to strengthen some foot muscles by lifting the arch. And calf raises are also another great option, right? But the second way that we could actually strengthen these muscles is through wearing minimalist shoes, okay? In healthy individuals, if you wear minimalist shoes for at least 8 weeks, you can actually improve the strength of your foot muscles, okay? And so you may know minimalist shoes as these 5-toed shoes. I don't know if anyone has those. But today, minimalist shoes can look a little bit different, right? I wanted to share some features of minimalist shoes. And the main idea with minimalist shoes is that they should minimally interfere with the natural movement of the foot. Okay, so they're going to be wide so that the toes can really operate like they're supposed to. They're also going to be very flexible. And they're going to be thin and zero drop. Now, zero drop just means that the heel and the front of the shoe are the same height, which is, what a normal foot flat on the ground is like. So that's kind of an important component as well. But the main idea is that the lack of support from the shoes will then demand support from the foot muscles, which is why they can improve in their strength, okay? And so we know that if healthy individuals perform strengthening exercises and wear minimalist shoes, they can increase their foot muscle strength, okay? Now, if people with heel pain do these same things, right, we see that they can actually decrease their pain and increase their function, okay? So the question is, if we can use minimalist shoes in healthy people and see these improvements, can we use them in people with heel pain? And will we see, similar things with their foot strength. So the sole purpose of my study was to determine if performing exercises and wearing minimalist shoes can lead to better outcomes in pain, strength, and function compared to exercise only. So I conducted an 8-week randomized controlled trial, and there was an exercise-only group, so they did exercise only, and the frames group was the foot rehab and minimalist shoes group, okay? And that was the experimental one. So my hypothesis was that the frames group, or that combined group of exercises and shoes, would perform better than the group that only did exercises. So first I got some self-reported outcomes, okay? This is very important to understand how they feel about their pain. So I asked them about their pain on a 0 to 100 scale, like this, but just, 0 to 100. And then I also asked about their function with something called the foot and ankle ability measure. And that essentially asks their difficulty with doing certain tasks, like going upstairs, squatting, walking, all types of things like that. And then I measured this at baseline, at 4 weeks, and then 8 weeks, which is really just the end of the study. And then I also looked at foot strength, okay, which is, I use this device called a dynamometer, which is just a force sensor. So I guess it might be kind of hard to see, but in this position here, the person's toes are hanging off the edge of the table, and they're pushing down as hard as they can to try and get a force reading. Okay, and so I completed it separately for the big toe and the little toes, because they, have quite different jobs, so it's important to separate them. And I measured this at baseline and at 8 weeks. So the intervention was supposed to be performed every day at home, and so they did a foot massage, calf raises, and then 2 different calf stretches, and then a foot stretch. Okay, so they did these every day, and they even filled out a survey every day that indicated if they did the exercises or not. And then the shoes, they wore these Zero Shoes HFS2. That was the model, and they were to just wear these during their activities of daily living, but they couldn't run in them. And then we had a transition protocol into the shoes, so each week they kind of increased the amount of time that they wore the shoes, okay? So for statistics, conducted repeated measures ANOVA tests, and essentially wanted to know, right, over time, does one group perform better than the other? So when we go to our results for participant demographics, okay, so I had 34 total people. You can see there's 16 people in the exercise-only group and then 18 in the frames group. And then there's 5 males in each group as well. So it kind of worked out that way. And it's important to note that there are no significant differences between these demographics at baseline. And that's important because age and weight can be a risk factor for heel pain, so I wanted to make sure those were, similar when we started. So this is kind of a lot, so I'm going to just kind of orient you to what this is saying. So the dotted lines and the squares are for the exercise-only group, and the blue circles with the solid line are for the frames group. Okay, and so what we see is that there's significant main effects by time for pain and function, but there's no interaction. Okay, and so what that really means is just that both groups significantly improved their pain and function to similar degrees. And you can see, of course, there's little asterisks and the p-values up there. Those are indicated for the total cohort. Okay, so everyone in the study. And what we see is that they had significant improvements even after 4 weeks. Okay, now when we look at toe strength, or foot strength, it's kind of similar. Again, if you look here, there's significant main effects by time, but not by group, okay? And so again, this means that both groups significantly improved in their foot strength to similar degrees, okay? So if we take a step back to our research question, okay, we want to know, for individuals with heel pain, are exercises and using minimalist shoes in daily activity better than exercise only, right? So when we go toe-to-toe, the minimalist shoes did not show any significant benefit over the exercises alone. However, right, all participants significantly improved their pain, function, and strength, which is great, right? So my overarching takeaway is that while using minimalist shoes as an intervention is not a shoe-in, right? Movement and strength-based interventions are really important for healing in this population. And patients with heel pain are often advised to only choose really stiff and thick shoes with a lot of support, right? But this might point to reducing restrictions in footwear and allowing people to choose what's comfortable to them, right? We shouldn't have to be forced to wear uncomfortable shoes. And then you probably saw in my footnotes, but I have my references there, but they're also listed up here. Thank you guys for listening. Had a really great time. Okay.